Pleasure for me to welcome her here. Will you please join me in welcoming our 2013 Commencement speaker, Dr. Regina Benjamin.
Good morning. Like the sunshine. So thank you. And to President Harvey, to the trustees, to the faculty, parents, and friends, to my sorority sisters of Delta Sigma Theta, yeah, gotcha. And to also the other Divine Nine fraternities and sororities that are present, but especially to the class of 2013. On behalf of President Obama, I bring you sincere congratulations. I am truly honored to be here today at your home by the sea to be a part of this very, very special day. It's special for so many reasons. Dr. Harvey said a few of them. But also today you're joining the 6.7% of the world's population to have a college degree. And for some of you, even a smaller percentage with an advanced degree. But even a smaller percent with a degree from Hampton University. Hampton is ranked number 4 in the nation, the U.S. World News and World Report, as in the HBCU rankings, number 4 in the nation. It's also been named by the Princeton Review as one of the 2013 best colleges in the nation. Hampton University is leading the Cancer Research Institution, and you're saving lives with the Proton Therapy Institute. And now, how many universities are launching satellites to understand global warming and hurricanes? You're graduating from a university that's launching satellites into space. You truly have a lot to be proud of and to brag about. And it's truly the standard of excellence in education for life. I thought I would share with you some of my personal experiences and hopefully kind of stimulate some of your thoughts and just tell you some of the things I was doing before I took this job. When I was an intern, I attended the Medical Association of Georgia's annual meeting. And one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in the medical schools. I stood up in a room with maybe 25 people and I told them I had never seen certain diseases except in a textbook. And I had just finished medical school. The group agreed and they passed a resolution. And they forwarded that resolution to the American Medical Association. They sent me to the AMA to speak to the same issue, and the resolution passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when the National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor. Too poor to afford medical care, but too rich to qualify for Medicaid. I like the people, I like the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape, and all the things that go along with it. And I decided to stay involved in my community. I stayed involved in every organization there was, the United Way, Red Cross, Girl Scouts, Chamber of Commerce, any organization to help us get services to our community. I learned that my patients had problems that my prescription pad by itself couldn't solve, like adequate housing, especially after Katrina, employment opportunities, and clean water. The entire community depended on the water. I want to tell you about one patient, one of my patients, Ms. Smith. That's not her real name, but that's what we call her HIPAA name. That's a name to keep her anonymity. But Miss Smith is an African, or at the time was an African American woman, and about 38 years old or so. Miss Smith worked as a janitor in our school. She called me on a Saturday, and she told me, and patients would call me if they had a problem, they didn't abuse it. So she called and she says, Dr. Benjamin, my back is really, really hurting. I went to see that specialist you told me about. He said I have a slipped disc, and he told me I needed to lose weight, and I'm really trying. But the medicine you call me in isn't strong enough. Can you call me something stronger? I said, sure, I can call you in something stronger, because I could hear the pain in her voice. I said, but you got to come and see me on Monday or Tuesday. She said, I will. And so on Tuesday, I walked in the exam room, and there she was, leaning over the exam table in so much pain that she couldn't sit down. I said, Miss Smith, did the medicine I called you in, did it help at all? She says, well, Dr. Benjamin, I didn't get it. I said, what do you mean you didn't get it? She said, I didn't have the money. I said, but you've got insurance, you work at the school. What do you mean you didn't have money? She says, well, I don't have the copay, but I get paid on Friday, and I promise you I'll go get it. And I said, oh, okay. So I stepped out of the room, and I had Nell, my nurse, go across the gym, our pharmacist, across the street to get the medicine for her, and I brought it back to her. And as I walked in the exam room, I handed her medicine. I said, Miss Smith, I know you're hurting. Here's your medicine. I want you to start taking it so you can start to feel better. I can see how much pain you're in. And at that moment, her eyes welled up with tears. She says, oh, Dr. Benjamin, I didn't want you to have to do that. I'm so embarrassed. And I realized at that moment, I had taken her dignity. And I also realized that cultural competency has nothing to do with the color of your skin. It has to do with allowing people to maintain their dignity. So I had to figure out how to get out of it. So I told her about the fact that after Katrina, we had a small pot of money that people would donate for our medication fund, and it was for times just like this. And if she wanted to pay it back on Friday, she could, but she didn't have to. And she was okay with that. And as I was leaving the room, she says, oh, by the way, I said, yes. She said, can I get a work excuse? I said, sure, you can get a work excuse. Today is Tuesday. You want to go back to work, start taking your medicine and go back to work on Thursday or Friday? She says, oh no, we have to strip those floors tonight. Here is a woman who can barely stand up and cannot sit down because she's in so much pain, that she's willing to strip the wax off the floors so our kids can go to school in a clean environment. So it was for her, and particularly when the Affordable Care Act passed, that I said this was, and they required insurance companies to cover preventive services with no copay. That's my Mrs. Smith's accomplishment. So it's for Mrs. Smith and thousands of patients like Mrs. Smith that President Obama and the Affordable Care Act is intended for. The Affordable Care Act is not just about building a smarter, sustainable healthcare system. It's about making sure that every American gets the care that they need, when they need it, and at a price they can afford. Ensuring that people with pre-existing conditions finally get covered, to helping seniors pay less for prescription drugs, and guaranteeing that women don't face higher rates just because they're women. We're focused on what matters most in healthcare, and that's making sure that every American family has the security of knowing that their loved ones can always get the care they need when they need it. We need your help in spreading the word and getting people enrolled in the marketplace, which is going to officially begin in October. You can go to healthcare.gov and you can learn more about it, but we really need to get people to know about it, and we're going to need your help. And what greater group than those of you right here graduating today. Prevention is the foundation of the public health system, and prevention is the foundation of my work as Surgeon General. And I thought I would just tell you some of the things that we've been working on. we have a national prevention strategy, which was formed out of the Affordable Care Act. We have 17 cabinet-level heads of departments: the Secretary of Education, the Secretary of Health, Transportation, USDA, the Environmental Protection Agency. All of these secretaries sitting around a table for the first time ever talking about prevention. And so we created the National Prevention Strategy, and our vision is to change our healthcare system to one based on sickness and disease to a system based on wellness and prevention. Our goal is to make sure that every American is as healthy as they can be. So we want to increase the health of everyone and as active as they can be. Other things we're working on is obesity with the First Lady, childhood obesity, and active living. I have a breastfeeding report that came out, and I'd like to thank those of you who helped with trying to support women who want to breastfeed, particularly African American women who are not. And there's so many positive things about breastfeeding. We know they're positive for the baby, but if a baby is exclusively breastfed for the first 6 months of life, they're less likely to become obese. And a mother who breastfeeds is less likely to get breast cancer or ovarian cancer. We need to support them as much as we can. We also released a report on mental health. Actually, it's the suicide prevention strategy. Every day in this country, 100 people die from suicide. We need to start to talk about suicide. Those suicide survivors will tell us that they had wished that somebody had talked to them, and many of them survived because someone did ask them. We used to be afraid to talk about it because we were afraid to give them an idea. They want to know that someone cares. So there is, you can help and we can prevent suicide. We have a youth violence report coming out, and for the pharmacy students here, one of the areas is medication adherence. It is so important that we get people to take their medication as directed. They often don't take it because they don't know how to take it. They may want to stretch their medicine a little further, but it's going to be up to the pharmacists and the clinicians to help them understand that. So you've got your jobs cut out for you. We also have prescription drug misuse in youth, and that's a major problem. But the last one we have lots of other public health issues, but the last one I want to talk about is tobacco in youth and young adults. Every single day in this country, 1,200 Americans die from cigarette smoking. Each one of those deaths is being replaced by 2 young smokers. We call them replacement smokers. 90% of all smokers start before the age of 18. 99% start before the age of 26. So if we could just get our young people not to take their first cigarette before the age of 26, they're less than 1% chance of ever starting to smoke. Tobacco companies know that. Thank you. They know it because they spend over $1 million an hour on marketing to 18 to 26 years old, $27 million a day. So we have an initiative that we started with tobacco-free campuses, particularly focusing on HBCU campuses like this one. While many of them, including this, is smoke-free, we want you to become tobacco-free, all tobacco products. So we also need your help in passing that message about becoming tobacco-free. So those are some of the things we're doing. But what I really want to talk to you today is about service. Dr. Harvey he did tell you about service. I'll say he mentioned it, he talked about it. But it's often said, you make a living by what you get, but you make a life by what you give. It is so important that you stay involved in the community, because each one of you will become important members of your community, and people are going to look up to you. They're going to respect you, one, because you have a degree, one, because you have a degree from Hampton, so they're going to expect great things from you anyway. You have been doing activities while you're here during your time at Hampton. Things like the William R. Harvey Leadership Institute, your students' MLK Day, the Day of Service where you went out and did so much there. the Speech and Language and Hearing Institute that provides clinical services to the community. And many of you participated in the food drives to the food bank. And you have the mentoring groups like the Rose Petals and Boys to Men and the EYL, Emerging Youth Leaders. I also learned that the accounting students have volunteered to do tax returns free to the community. What a service. And some of you even traveled as far as Austria to volunteer for the World Youth Olympics. These are the things that will make you part of your community. You're already doing it. Here, it's part of your curriculum. It's part of what you're learning here. You learn those great skills that take you into life. And that's what you've been doing. Leadership is so important. I have two favorite styles of leadership, and one of them is the servant leader. And that's what Dr. Harvey kind of mentioned, is the servant leader. The person who sees something needs to be done and they just do it. They don't wait to be asked, they do it. They don't do it for the glory or for the fame or the recognition, they just do it to get it done. You see that kind of servant throughout the Bible. You see that every place. You see it in the history of this institution when 27-year-old Samuel Chapman Armstrong, with the aid of the American Missionary Association, didn't have to start this university. Just saw the need, and service was part of it to get it going. Dr. Harvey is an example of service. 35 years of servant leader. I cannot think of a better servant leader than him. He didn't stop at serving just Hampton University. He and the university are serving the community, increasing jobs and expanding the tax base in the city. And the university and Dr. Harvey are the best examples of a corporate servant leader. The other leadership style that I like, I made up the name, but I call it leadership from behind. And that's when you've come up to when you come up to a point where you're successful and you want to reach back and bring others up as well to make sure that others are successful like you. And that's a good leader. But a great leader won't stop there. A great leader will also push them out in front of them and let them know, like many people say, we have their back. You will stand behind them. If they start to stumble or start to fall, they know that you've got their back. That's what your faculty, that's what the staff here will be for you for years to come. They will always have your back years after you leave here. One place I'd like to mention to you is, I'd like to ask you to encourage minorities to go into health careers. Because while 30% of our population is minority, less than 6% are physicians, similar to pharmacy and dentists and other health professions. That's the same percentage as during the Flexner Report of 1913. Hampton's doing its best to increase those percentages. I encourage you to also think of other young people and encourage them. Because you never know who's watching you. They're watching you today. They're watching you get your degree, and they're going to want to be like you. I remember when I would get my name in the paper or magazine at home, and I'd be seeing patients, and I didn't want to stop to take a call from a reporter, and because I was just like, I don't have time, I've got patients to see. Until one day I got an envelope in the mail, and in that envelope was letters from a second grade class, and each one of those letters says, I saw your picture in the paper, I want to be a doctor just like you. Those awards aren't about us, they're about those kids who see us getting those awards. They're the ones who see us getting those degrees. So you never know who's watching you. While you're doing all of the things I've asked you to do, I want you to take time for yourself. As America's doctor, it's important that you take care of yourself. On the flight here yesterday, the flight attendant said, put your own face mask on before attempting to help others. you got to take care of yourselves. You've got to rest and exercise. Stay in touch with your friends, your lifelong friends that you have here. Play, have fun, walk. We have a walk-in initiative to make sure you enjoy it. And finally, I want to end with a poem, and it's by an unknown author, but it was one of Benjamin E. Mays' favorite poem, and it's entitled God Minute, and it goes like this. I have only just a minute, only 60 seconds in it, forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give account if I abuse it. Just a tiny little minute, yet eternity is in it. I hope you will take your God minute and go out in the world and make a difference. Congratulations, class of 2005.